Hello friends, welcome to my channel. Today we are going to concentrate on some advanced terminologies in oral pathology. So first, so first, let's look into the word pre-malignant lesion. Pre means before or previous, and malignant means cancerous, and lesion, I have described this term in detail in my previous lecture. If you have missed it by any chance, then you can go and look into it. Lesion means an altered tissue. So with this we got to know pre-malignant lesions. It means that it's an altered tissue which occurs before cancer formation. Okay, now let's see the definition of pre-malignant lesion. It's a morphologically altered tissue in which cancer is more likely to occur than in its apparently normal counterpart. We have already discussed it. Now, looking into these examples, we have leukoplakia, erythroplakia, candidiasis, carcinoma in situ, and smoker's palate. You don't have to worry about these terms, you just have to memorize them for now. I'll be dealing with all these terms in detail in my coming up lectures. Here I have given the picture of leukoplakia. This is leukoplakia. It's an altered white patch. And this is a picture of candidiasis. Now come moving on to the next word or terminology is pre-malignant condition. Unlike in lesion, there was only one altered tissue, but in condition there are many tissues involved and this spreads over a large area. Now let's see the definition. Pre-malignant condition is defined as a generalized state in which there is increased risk of cancer. Examples are oral submucous fibrosis, siderophenic dysphagia or Plummer-Vinson syndrome, lichen planus, here I have a picture of lichen planus, syphilis, and epidermolysis bullosa. Again, don't worry about these terms much. I'll be dealing all these terms in detail in my coming up lectures. Moving on to the next term, we have neoplasm or tumors. It is an abnormal mass of tissue that results when cells divide more. This is very important. Neoplasm occurs when cells divide more than they should, or they do not die when they should, and it's indicative of cancer. Now, coming to the next term is neoplasia. Neoplasia is derived from the term neoplasm, but I've included this word because plasia has got always something to do with cell division. Plasia is nothing but cell division. So, neo means new, plasia means cell division. So, it means new cell division. Moving on to the next term or word, we have plasia. Plasia, as I said in my previous slide, that it deals with cell division. Okay, so let's see its definition. It's growth, cellular implications, or division of cells. Now, coming to the next word, we have hyperplasia. Plasia, we know cell division. Hyper means increased. So, with the name, we got to know that it's increased cell division. So, let's look into its definition. It is an adaptive cell change involving an increase in the number of cells of a tissue or organ. Here you have a picture. These are normal cells. As you can see, they are 4 in number. Okay. And over here we have an example of hyperplasia. As you can see, there is a change in the number of cells. there is an increase in the number of cells. This happens in hyperplasia. Now coming to the next word is hypoplasia. Plasia gains means cell division, hypo means reduced cell division. Let's look into its definition. It's an incomplete development of tissue which is caused by decreased cell division. Okay, decreased cell division will form incomplete tissue. The example of it is enamel hypoplasia. We'll be talking about this in detail in my coming up slides. The next term which we are going to study today is aplasia. Plasia is again cell division, but whenever you see a word being prefixed by A signifies to absence. Absence of cell division result in incomplete or faulty development of a tissue or an organ. It's another name for hypodontia, which is absence of some teeth. Hypodontia means absence of some teeth or few teeth. Another term for hypodontia is dental aplasia. Aplasia is absence of cell division which result in absence of teeth. Coming to the next term which we are going to study today is trophy. Trophy means enlargement of cells. It differs from plasia in that it does not have increase in the number, instead the cells enlarge. There is in trophy, there is changes in the size of the cell, whereas in plasia we studied that there were changes in the number of the cells. So let's just see the next term, hypertrophy. Hyper, means increased, and trophy means the size of the cell. So increase in the cell size means hypertrophy. It is the enlargement of an organ or tissue from an increase in the size of its cell. Here you have a diagram. These are normal cells. As you can see, they are 4 in number. And this is hypertrophy. As you can see, even over here, the cells are 4 in number. But there is an increase in the size of the cells. This is known as hypertrophy. Increase in cell size is hypertrophy. Now coming to the next word which we are going to study today is atrophy. Atrophy means again A signifies to absence, and trophy, which we have already studied, signifies to size of cell. Now absence in the cell size, like if there is some morphological defect in the size of a cell, this results in thin epidermis or dermis due to decreased function of the cutaneous cells. Decrease in size of the cells, or if the cell size is decreased, ultimately the tissue will get, see, cells combine to form a tissue and tissue combine to form an organ. So cell is the basic unit of life. We all know that. Okay, so if there is some abnormality in the cells, then obviously the tissue will be abnormal, and then the whole organ would be abnormal. Okay, so defective cell size can cause wasting away of tissue. Okay, coming to the next terminology, we have miscellaneous terminologies which are different from the clinical terms. They are associated with the lesions. So first we are going to study, the first is not a lesion, it is a terminology used to define an extravascular fluid. And what do you understand by the term extravascular? Fluid present around the capillaries means extravascular. Vascular means capillaries, extravascular fluid means fluid outside the capillaries. And transudate, it occurs due to hydrostatic imbalance, that because of difference in pressure between the capillaries and the surrounding environment. And transudate has got low protein content and no cells in the fluid. There are no cells or solute components in the transudate in this fluid. Now coming to the next term, we have exudate. Exudate is an inflammatory extravascular fluid, which means that this fluid will be present only during inflammation of tissues. Only if there is inflammation of the capillary, you will find this kind of fluid in the surroundings of a capillary. Exudate result is a result of increased vascular permeability, and it has high protein content. It contains polymorphonuclear neutrophils, cellular debris, and red blood cells. All the components of red basically come out from the capillaries into the surrounding tissues. Now, why and how does this happen? Let's see the differences between transudate and exudate. So here we have three diagrams. The first diagram is of a normal blood vessel, and in the second diagram I'll be explaining you about the transudate, how this transudate fluid occurs or accumulates. And in the third diagram, I'll be explaining you about how this exudate is filled around the blood capillaries. So in the first diagram, this is the wall of blood vessels or capillaries. These are endothelial cells, and this is fluid present within the blood along with its proteins. Now let's understand what happens in transudate and exudate, how these two things are different. As we have already studied, that transudate occurs because of hydrostatic imbalance between the capillaries and the surrounding tissues. Now, what is hydrostatic imbalance? It means that when so for example, it's in increased blood pressure, when the blood with high pressure is hitting along the walls of the capillaries, this causes outward movement of water or leakage from between the endothelial cells into the surrounding tissues. There is no change in the size of the capillaries nor the endothelial cells separate from each other. Hence, we only have the fluid leaking. And since no other blood components like protein excrete out, there is decreased protein content. Now coming to exudate. As we have already discussed, that exudate occurs because of inflammatory response. If you have noticed, I have drawn this capillary a little bit bigger. Can you say why I have drawn it bigger? If you are thinking that is because of inflammation, then you are right. Because of inflammation, the capillaries swell. And once they swell, they create a gap between the endothelial cells of the capillaries. Since gaps are created, the fluid along with the proteins are expelled or leaked out of the capillaries into the surrounding environment. Hence, we have increase in protein content, and since it is an inflammatory response, we have the inflammatory mediators like polymorphonuclear neutrophils or leukocytes present. So this is how there is a difference between transudate and exudate. Transudate occurs in high BP whenever there is a hydrostatic imbalance, and exudate occurs in an inflammatory response, swelling of the vessels, which creates gaps between the endothelial cells, allowing free passage for the proteins to flow out of the capillaries into the surrounding environment. Now coming to the next term, these terms are related to lesions. Pedunculated. Pedunculated means with a stalk. Okay? These lesions with stalk are usually mushroom shaped. They have a stalk like a twig. This is a stalk. With the help of a stalk, they attach to the surface mucosa or the epidermis or epithelium, and it is associated with benign tumors. Coming to the next word is sessile. Sessile is the opposite of pedunculated. It is without stalk. If you see a lesion without a stalk, then it is known as sessile. Now coming to the next term, this term is coalescing, which means to fuse. Now I can give you an example of mamelons here. The mamelons, and they represent the growth centers. So these growth centers, they fuse. The term for fusion, or something which is growing together, and it or something which is merging, is known as coalescing. Next term we are going to study is exophytic growth. Exo means out. Phytic is area or place where it is present. Okay? Growth. It's a growth which is present outwards. So with this we got to know that it is a growth which is present outward. So let's see its definition. Exophytic growth means growing outwards beyond the surface of the epithelium. In my next lecture, I'll be talking about developmental disturbances of oral and paraoral structures. I hope this video was helpful for you all. Please like, share, comment, and yeah, don't forget to subscribe. And yeah, hit the bell icon and get updated with my latest videos. Thank you.